So a day one in my clinic was um so when was going I woke up at 5, then I went I arrived at 7:19, and then we got in at 7:30. Then we got some orientation, we got into a meeting at around 9 to 10. Yeah, we're given the hospital uh rules and regulation. And then remember, in our timetable, I knew and I was supposed to go to start in OPD site for 2 weeks, only for our mentor to tell us that our group, which we are 7 people, we're supposed to start. No, because OPD is already occupied. We'll start at surgical male ward. Okay, I wasn't prepared for that, because one thing is that I went knowing that I'm starting at OPD, and I saw OPD because it's basics. It's going to be a little bit easier, and it's good to start with easier things which are like not that hard, yeah. So basically that is what happened. And I was like, what, surgical male? And I didn't know what it entails. And earlier when we were in a meeting, the supervisor was telling us I was emphasizing more of male or medical male ward, and I thought it's going to be the hardest one. Only to realize that those people actually they didn't do anything for the first day. Okay, so let me tell you. Our first day, I can't say it is bad, but it was, I feel so tired right now, because so it's the first day, and after two explanation by our supervisor, the nurse now who was guiding us. Imagine we started now giving the drugs, uh we started now administering the drugs, IV actually, which actually was the most in the surgical male ward. And after that, the treatment. Okay, let me talk about the treatment now. So my friends, they did about giving IV. Okay, I said, I think the one thing that I did, most of my friends did giving their even IV drug, the dose, the dose, as in diluting of the drug, yeah, and giving it. I think the only thing I gave it, I think is it ceftriaxone? Yeah, I gave it IV set. It's an IV set, but the patient was already cannulated. Let me tell you first, it's my first time to do this, and actually I made a little bit of mistake, but we still learn from mistake. And I didn't beat myself up, because the nurse was so calm and nice to me. So I when I was putting that whatever the IV set, somehow the drug now started dripping vibaya. Okay, the English is inapotea. Okay, so but she was so calm, she didn't shout at me, and I thank God for that. Then when I gave the IV set, it was not dripping. It was not dripping. And actually I think it's from when I was opening the cannulated patient, and I think I messed up a little bit, and I think that's is the anxiety of the first day. But I thank God the patient is okay. So ikakataa could drip. So you know what, I went to the nurse and told her the thing, actually is the patient who commented on me, the thing that you placed is not dripping. So I went and told the nurse, and she was like, okay, she was finding a solution. She was telling me to position the patient hand until I see the dripping. Until I see the dripping, I did that. It was not working, and so again I went and I told her I've tried my best, but it's not working. And now she found what we call what is it? Oh my, I'm forgetting the word. Flash, yeah, the saline, you flash water. So to confirm if now the IV set, or if the cannula is still patent. So I did actually that, and I confirmed, and the cannula was still patent. So I don't know why there was not dripping. So after now confirming that the cannula is patent, well, you know what I did, the next thing I did is that I again inserted the IV set of the drug, and ikaanza kukatakata kiasi kudrip, but later on we acted on the nurse and actually it dripped, and patient akakunywa dawa as dawa ikadrip vizuri. And when the time was over, I went and I removed the drug or that set, and yeah, nikaacha hivyo. And one thing that shocked me is that the patient I was attending nikam anajua hizi vitu because he was telling me do this, and so ananiuliza mbona natetemeka, and actually I know it's my first day, and I think him telling me that somehow made me feel like I should not be scared of anything, because even them, the patient, they're so calm, they're not complaining because I'm a student, they're just so cool, and I'm so happy because they didn't shout at me, they're just so calm and even willing to help me and telling me what to do. So imagine a patient. Not that I'm not competent or I'm not believing my work. I'm just so like happy that they're so good, and they're not saying I don't want to be treated to. They're not. I was expecting them like for them to say I don't want to be treated by this student nurse next. No, they were just cool, so calm, and actually they helped me even become so comfortable myself. So after the drug administration, we went now to hey, I tell you, at that time I was feeling so angry, tired, because now I was feeling like so tired. I don't know why I was feeling so tired. Oh, I prayed now to get used to this work, because hey, we were staying from 7:30 to 4:30 the whole day with 1 hour lunch break. So I have to get used to it, and I pray to God I nizoe. So after that we went to dressing. Okay, I don't know how to say, but hey, undressing. I can say that this is the first, I don't know, it was a kind of new experience, because you've been used, tumezoea ile kuambiwa kuna watu kuwa na vidonda zinaoza, watu kuwa na hizi vidonda like sijui zinakaa aje. So mimi nimeenda the first wound. I'm not going to, I don't know how to describe it, because I don't know if it's ethical, but it was so bad. Okay, let me mention the condition that the patient was suffering from: the male genitals. It's called Phonias wet gangrene. It's a wet gangrene. It's a kind of one. I googled, because I tried to Google that it's a assignment were given, and I think I searched it, but I'm not that enough. It's caused by microbes, like a lot of it's like compound infection. A lot of infection, both aerobic and anaerobic. That infection maybe in the genital tracts, maybe at sometimes called legs, in infect the patient. The hiyo wound inaweza kukua necrotized, like inaanza somehow looking as necrosis, but it's a gangrene, you know. And now what happens now to the genital tract, it starts now kupasuka, and it becomes undefinable. Like you can't say that is a genital, yeah, a person, yeah. So one thing is that it was so bad, but as young as a student, and the first time I think I saw us having the confidence, we didn't run away. But then so the few to actually I felt like, you know, enough, you know, that word is so, it's like, I don't know what to say, it's smelly. Okay, yeah. But one thing is that we didn't run away, we didn't have mask, and the nurse that we had was so kind and so good to us, and he was willing to teach us. So one of the students volunteered to help the nurse to clean the wound. I was just an observer, but I didn't away. I kept looking at the wound so that I cannot run. I just have to get used to myself to see those things. That I just have to get used to seeing those things, because I have no option. I can't run away from this. I chose this for myself, so I have just to see it, get used to it, because there come a time when I have to dress, and I will not run away from it. So definitely, sing run. I remember, although I kumbuka one of my friends in our group, when he saw the wound and he started, you know, visualizing the picture, because it was so bad. Alitoka nje, the guy was sweating, profusely, and then he started feeling dizzy. So I can tell it was so bad. Others were running away from that situation. They saying, no, I can't bear seeing someone going through that. But one thing is that kept me from not running or just being confident, and just it keep running, na nisiweze kunini. It's how the calm the patient was. The situation and the wound is so bad. but the patient is calm, is like ingia kwa ward yenye patient is so sick, kana wound, the very bad wound, but anajirumia, analia, hadi wewe ungeweza kufeel huruma, then usijui, you'd feel so discouraged and I don't know what. But that person was so calm, he was clean, he was cooperating, because when the nurse was telling that person to turn, he was turning. It's painful, but the person is so cooperating, and it made me feel, wow. I don't know, I just loved how the patient cooperated. It's not easy, but he still did so. He bared with the situation, and he was so cool. So the wound was cleaned, because now it's an open wound. Itadressiwa, because it's I think it's a second degree wound, so it can't be dressed. It just clean. Yeah, it's cleaned. Then the pampers is placed, because actually even the wound was oozing pus. So you can imagine how that wound is. So I think I've explained about this wound. Actually, that's the thing I've seen new. Fourniers gangrene. So that is a banning. So one thing is that as people, please maintain hygiene. Hygiene is important, because poor hygiene can cause that one. If you have any local trauma in your genitals, please treat it lightly, and please avoid infection in those areas. UTI is another thing that can cause it. UTI, so it's bad. So whenever you see a small ama umeanza kufurafura kidonda kandogo, please do not let it grow. Just fika hospitali mapema uhudumiwe, because just fika, because hospital you find nurses who are willing to help you, and I think it can be treated. I think nurses can do their. The way I've seen is, despite the situation in Kenya right now, because when we were coming, when coming from hospital, you're telling us how much we are, like, when we see nurses there, they are trying their best, because wajalipa mishahara miezi mbili, but they're still doing their work. So I'm just proud and happy of the nurses and how their work, like they're trying their best. Yeah. So okay, nishamalizana na hiyo ya wounded kwanza, then tukaenda kwa mwingine. There's a person, I don't know how to describe it, but the next patient, though I didn't participate that much, because I went to somewhere else. That person had we call bed sore, pressure sore, because he's not turning sana, so he had to be cleaned, and also he had a shoulder cancer, so ilibidi, shoulder cancer, which cost him like a konde sana, like what you could see, it's what is it? You can see bones, like visible bones, rib cage. These are also you can see. Like, it was so bad. And one of the students asked, so if you were to give IM injection, where would you inject, because there's no visible muscle? So one thing I'm hoping for is that those people will get better. I'm really praying for them, and I pray that God will heal them. Then next, I went to dress another thing. Actually, was a student. Actually, a student from other school who experienced now came and said that they were going to show us to dress a patient with I don't know, you call it gloving. This is like skin peeling, and now it looks like a burn wood, but it's not really burn wood, but even the ilikuwa. So mimi kitu nilifanya, the wound was so bad. Actually, one of the colleagues alitoka akaenda akasema tayari alisema no, aivumilia nikajijaza, sina mask, the wound, that wound is smelling, but kwanza kutoa the wound, nilikuwa naona wakimwagilia saline ili ni kama ete kushikana na kidonda hiyo bandages, so kamwagilia, then sasa nikaanza kutoa. Oh, it's smelling so bad. I don't have a mask, and others are asking, should be having a mask. Oh, tomorrow I'm going to carry my mask. So nikatoa ikaisha. Though nilikuwa nimejeka vizuri, I had once clean gloves, then another after, and then nikavaa pia a sterile gloves, so I was safe. So nikatoa, I thank God niliweza kutoa hiyo. Yeah, but at that time bado nasikia nimechoka, nasikia kijoto sijui kinatoka wapi. I feel so tired. I feel my back is pain. I feel back pain. Miguu zimechoka. Is lunch time, niko na njaa. So nikawasaidia tu clean. As in that patient was, tuko na those elders, I think kuna shule zingine, but the link the more experience, we will dress that patient and ikakuwa sawa. And hapo ndipo niliona tulikuwa to dress the next patient, nilikuwa na Mr. Survive. Mimi nikatoka nikacha best yangu ndani akafanya hiyo dressing, though nasikia alifanya vizuri. Mimi like sitavumilia, like I was feeling nikaa naweza anguka. Sijui kama nikuchoka kama nini, like mimi nimechoka sikia leo kutembea sijui nini, but I'm so happy I got to help some people. Adikana nilikuwa ni kuobserve ama kusaidia kidogo. Buraki ulifanya something and it's first day. I think it's something to be proud of. Kutoka hapo tukarudi, tukaenda lunch break. Tukaenda lunch break. So tukakula, tukarudi. Kutoka hapo kwa na kazi mingi. Before to check out, tukaelezea kesa staff za Cadex, staff za kucheck in, watu tumeelezea ma staff. Tukaelezewa nini ingine sijasema. So tukaelezewa hizo staff zote na tunapaswa kufanya out. We have to come out kesho, the next day tutafunzwa about digital to automate a patient using in the system na kuresearch in the system. Hopefully nitalana, nitaelewa, na naomba Mungu nikuwe mtu niko willing kulana. I won't escape, I won't run. It's going, I know one thing is it isn't gonna be easy, but I have to bear with it. Lazima ning'ang'ane, lazima I chose this path, so I have to bear with it. Either iwe ngumu iwe yaje, naomba tu like niwezane. So hopefully hakikisha sitachoka sana na mapema hii, because naona nikichoka sana na haraka, but I don't survive I can survive. I pray to God it's something that I did that I am okay. Let me not talk about it, but I think the video has been good, though I feel so tired right now. But let me rest for tomorrow, because now I have to be waking up at 5:30 or 5 so that I can be taking the gari. I'm commuting so that nifike Osi mapema. Nikifika Osi ndio tunachelewa 7:30, nianze mapema nisichelewe, naomba lakini sichoke na nitoke like less hivyo tu. I think that is my day has been, and hope I have not mentioned anything that is not ethical. I've not mentioned anything that can put me to dark what is it called, dark spot or whatever. So this is June. Namsema nini? Goodbye. Nothing is good. It's good. It's a calling, by the way. It's not for it's not for the weak-hearted banner. It's strong-hearted.